So the basis of how I make an appointment in regards to lower back pain is that the first thing that I have to prioritise is a case history. I got to actually understand what is going on, and that's in regards to signs and symptoms or anything that makes your pain worse or makes it better. Because what this allows me to do is build clarity as to certain structures within your back, such as muscles, ligaments, joints, or the discs that may be contributing to your pain. What will that allow me to do is that encapsulate a clearer picture of patterns that might become aggravated or become easier, because different structures have different signs and symptoms. Depending on what you tell me about that, that's when I'll be able to actually formulate an examination to be able to examine the more specific structures that may be contributing to the pain, to kind of rule in or to rule out certain diagnoses, so that I'm able to, again, build a clearer picture about what it could be. So after I've explained the diagnosis to you, that's when I'd recommend a treatment plan. This treatment plan may change depending on what goals or aspirations that you want to achieve with your pain. Not everyone who does experience lower back pain necessarily wants to achieve the same things. For example, some people are long-term chronic sufferers of lower back pain, so they may be looking for more management styles of treatment, whereas other people may be brand new to lower back pain and might be quite scared or apprehensive and surprisingly quite worried about what may be going on. And then that's when the treatment plan would get recommended. And if you're happy with what I've explained, that's when we'd start hands-on treatment or integrating into other approaches such as the human specialist movement that we have here, or the chiropractors, or deep soft tissue massage. Typically speaking, the General Osteopathic Council recommends a 6 treatment plan for lower back pain. The reason being why it's 6 treatments is that it gives the practitioner a better opportunity and a better timeline to be able to treat lower back pain. So for example, if it was a simple muscle strain, that does typically take 6 weeks to heal. Whereas if it was a disc related injury, that can go into the 3-month mark. So it clearly depends on what has happened and then what's the presenting symptoms at that time. Some people who may have a disc injury may not present as the next person. So then that's when osteopathy is quite special, because it allows the practitioner to formulate the treatment plan specifically for what is needed to be achieved for the person who comes in for the treatment. That's a good question, because it does differ between individuals. So typically speaking, we use a multifaceted approach. So you may experience some spinal manipulation therapy, where you may hear audible clicks in spine. Typically speaking, it's majority soft tissue massage, which is more soft tissue therapy, and that allows us to work with the muscles to help alleviate pain within the muscles, but also the joints. Another popular technique that osteopaths like to use is joint mobilizations, and these techniques aim to improve function and the mobility of injured or dysfunctioning joints that may be restricted or may be guarding because of the injury. So typically speaking, when someone comes in with lower back pain, that can have an effect on the pelvis, the hips, the knees and the ankles, and that area might be too painful to actually treat. So then as an osteopath, I would look at treating from below and then working towards the issue, because that will allow me to address any more issues that may be a consequence of having the lower back pain. And then that thus allows the body of the patient to slowly but surely accept how the treatment influences their nervous system, and then settles them into treatment. And then when things start to calm down, that's when you can get to the actual causative factors of why you may be having lower back pain. Again, you could be lifestyle factors that could be affecting your lower back pain, or it could be a trauma instance where you slip and fall, or you might stand up a bit too quick, or you might bend over too much as well. So that's why with the treatment plans, they do and can differ, all depending on your own lifestyle specifics, but also the presentation that comes into the clinic door on the day. All of the lower back pain evidence for getting people to feeling more confident and getting the results that they want has to have a double-edged approach. Yes, osteopathy, and I'm a huge believer in the power of osteopathy, but it's not always the answer for everything. So that's why at Kube Medical, I think we're at a huge advantage, is because I do have access to the chiropractors, the deep soft tissue therapists, but also the human movement specialist. So typically speaking, I may have a person who comes in who may have a couple of spinal issues, a bit of neck pain, mid-back pain and lower back pain. That's where I feel that the chiropractors fit in really well, because they are definitely experts of the spine. Whereas with Nick, when I'm looking more for rehabilitation, exercise advice and stretching as well, I can focus on the osteopathy parts with the joint mobilizations, the spinal manipulator therapy and the soft tissue, and then Nick then can use his expertise to work on the rehabilitation program. And as I said, with that double-edged approach, it normally achieves really good results.